Buoy Health Insights. Dull, achy knee pain. Welcome to Buoy Health Insights, where we navigate through the world of health and wellness, diving deep into the causes, symptoms, and treatments of various conditions. Today, we're focusing on a joint that we all rely on daily, the knee, specifically tackling the subject of dull, achy knee pain. So, let's get to the heart of this discomfort, shall we? Acute conditions happen abruptly, while chronic ones build up over time. Dull, achy knee pain is often the latter, hinting at ongoing damage that needs our attention. Remember, those knees do a lot for you: walking, stepping, sitting, and much more. Keeping them in good shape is crucial. If you're experiencing persistent pain that won't fade away, sit tight, and let's explore the symptoms and causes that you should be aware of. And we'll wrap up with when it's essential to seek medical care. Symptoms to look out for: swelling around the knee, stiffness that makes your knee feel rigid, redness or warmth, suggesting inflammation, difficulty to fully bending or straightening the knee, the sensation that your knee may buckle or give out, noticeable popping noises with movement, challenges in bearing weight on the knee, notably after high-impact activities like running or jumping. Potential causes of dull, achy knee pain. 1. Patellofemoral pain syndrome. Referred to as runner's knee, patellofemoral pain syndrome, PFPS, is often associated with overuse, particularly in sports, and can result from prior injuries or misalignment in the knee joint. If you feel dull pain around the kneecap when running, squatting, or climbing stairs, PFPS could be the culprit. 2. Meniscal injury. The menisci are cartilage pads in the knee acting as shock absorbers, and they're prone to tears from twisting movements, or in older individuals, just by everyday activities. Pay attention to pain, stiffness, swelling, and any catching or locking of the knee. 3. Prepatellar bursitis. This is inflammation in the bursa at the front of the kneecap, usually due to overuse, arthritis, or certain physical alignments of the knee. Sharp pain, tenderness, and swelling are telltale signs. 4. Knee arthritis. Inflammation and degeneration of the knee joint's cartilage can be a result of various forms of arthritis, with osteoarthritis being the most common. Look for pain in both knees that worsens with movement, stiffness, especially in the morning, knee instability, and difficulty walking. 5. Jumper's knee, patellar tendonitis, an inflammation of the patellar tendon, which connects the kneecap to the shin bone. This condition can manifest as pain just below the kneecap and knee stiffness. It's typical in athletes whose sports involve a lot of jumping. 6. Iliotibial band syndrome, IT band syndrome. Not specifically quoted but part of common causes, it arises when the connective tissue from hip to shin is overworked, typical for athletes and those engaging in repetitive activities. Which symptoms indicate you should see a doctor? Constant pain that doesn't go away is a red flag. If you're unable to put weight on your knee, if it feels unstable, or if you notice significant swelling or changes in color or warmth, seeking professional medical advice is crucial. Treating these conditions can range from rest and physical therapy to medications for reducing inflammation like ibuprofen, and in severe cases, even surgery. But remember, the specifics depend on the exact issue at hand. For example, arthroscopic surgery for severe PFPS, or perhaps a tailored regimen of low-impact exercise and orthotics for misaligned strides. As we wrap up today's Buoy Health Insight, remember that taking early action and knowing when to seek help for knee pain is vital for your overall well-being. While dull, achy knee pain might be common, it's certainly not trivial, and addressing it properly can save you from further complications down the road. We hope this deep dive aids in understanding your knee pain and encourages you to take proactive steps towards a healthier you. And before you go, don't forget to like and subscribe for more insights into health and how to navigate its complexities. Stay informed, stay healthy, and see you in the next video.